Hi, Tracy from Healthwatch Milton Keynes. Just wanting to give an update on where we are with dentistry. We've been working really closely with the commissioners for dentistry for the East of England region and their team. So been having regular meetings with the lead dental clinician, with the head of contracts monitoring and the head of commissioning and public health and all of the people who have been really interested to hear what you've been telling us about the issues facing you getting an appointment. So through those meetings, we have found out that the best way to get an appointment, an urgent appointment, most dentists are still only able to take urgent appointments. They're working through a huge backlog. Obviously, since they've been closed since March, there's been a lot of urgent work that's needed to be completed. So for NHS dentistry, if you ring 111, NHS 111, and ask to have a dental triage. Now remember that triage will be done by somebody that is not a clinician. They're a call taker, so they've got a list of questions that they will run through with you. So you need to be really clear with them about your symptoms. A clinician may hear some little things that give them a bit of a clue that actually that does tip you over into being an urgent patient. But as that call taker isn't a clinician, they may miss those clues. So you need to be really clear about what pain you have. Is there any swelling? Is there bleeding? Is it stopping you eating? Is it stopping you sleeping? Are painkillers working? All those things, and depending on what answers you're giving will depend on whether you meet that urgent treatment criteria. Now, the 111 service will have a list of all the available dental appointments, and they will be able to make a referral into that dental practice. It may not be your usual dental practice, but you don't need to register with a dentist in the same way as you do with a GP, so it doesn't matter. I know you'd probably prefer to see your own dentist, but at the moment that might just not be possible. And if you need urgent treatment, then you need urgent treatment. So it's best to get to whoever can see you. Now the call taker may offer you a phone number to call. Our advice would be, after our conversations with the various dentists and the contracts team, is that you probably need to ask them to make the email referral to the dental practice, and then that dental practice will give you a call and make the appointment with you. And that's just around the dentists having to leave so many appointments available for urgent treatment, so they are relying on 111 to fill those, and they are being filled rapidly by 111 referrals. So even if 111 offer you the number, make sure you ask them to send that email referral through to the practice. That's the way you will get an appointment. Now there's been something else raised around maternity exemptions, and while we have fed that back to the monitoring team and the contracts team, the commissioning team, unfortunately that is something that is within the legislation and is decided at NHS England level. And while we have fed it back, and the team has been really, really keen to hear all the feedback that you have been giving us about the issues getting hold of dentists, they are going to raise it with NHS England, but it's unlikely that it'll happen sort of immediately. However, if you do, whether you've got a maternity exemption or not, if you do need urgent treatment through the 111 process, you will get that. The backlog is easing, so dentists may start being able to see non-urgent patients for treatment, but again, they may have people that had started a course of treatment before the lockdown, so they'll be prioritised over new patients coming for a routine checkup. So it's just a matter of making sure that people that are needing the treatment are getting the treatment first and then working their way through that. We definitely want to hear from you if you have rung a dentist and they have given you a checkup, or they've given you an appointment and said, yes, you need a course of treatment, and then tell you that they can't do that under the NHS, but they could offer you a private appointment. The contracts team would be very interested in hearing about that, so please do let us know. We will be feeding that back, and we are meeting with them on a weekly basis at the moment, so any issues you have, we can get them kind of explored, if not resolved, really quickly. So yay for dentistry. You can get some urgent treatment now. Thanks.